Hey, this is Dr. Joseph at Vail Summit Orthopedics, and today I'm going to talk about a very common entity that's patellar tendonitis. Patellar tendonitis is known as jumper's knee. It's very common in young athletes. It's also sort of common in older athletes like myself that are 50 years old, or the weekend warrior, let's call it. And so patients that, let's say, are a little bit older and not quite as elastic, which is what happens with life, can develop a patellar tendonitis. And it's also very commonly in a young athlete that's doing jumping sports or increasing their activity. So to explain it, basically this is the patellar tendon, of course. It comes off of your kneecap, the patella, and it attaches to your tibia. And so it obviously, when you fire your quadriceps, it makes your knee go straight. So the quadriceps pulls, of course, and straightens out the knee real simply like that. And what can happen is almost always at the inferior, meaning the bottom pole of the kneecap. So here's our kneecap, and you can obviously feel it pretty easy. As you make your thumb down and then it starts to fall off and get soft, that's the inferior pole. That tends to be almost always where patients get patellar tendonitis. And they'll have pain there. It'll start kind of subtly. It's not usually a single jump or a single injury. It kind of sneaks in, and then it becomes debilitating where they can't exercise. And when they do anything, especially involving the quads, like jumping, then they have debilitating pain that's there. And then it takes them out of the sport, and then they come and see us. It's very common, as I said, in younger athletes. The treatment for it is multimodal, meaning that there's not just one simple thing. First of all, what they never want to hear, but is the truth, is you have to do some sort of activity modification. So it's never the just push through it, even if it's no pain, no gain. That's not the idea here. If you keep on experimenting with pain, with patellar tendonitis, it's going to continue. And so that's the hardest part, especially for high school athletics, to say, all right, well, you don't play basketball for 2 months. So, but that's part of it, is activity modification. You can't experiment with pain, or it's going to keep on going and it's going to stay inflamed. It's not really torn tissue, it's inflamed tissue. And so therapy can help with that. There's a lot of tricks that therapists can use to help break that cycle of inflammation, especially younger patients. We never consider any kind of injections, and even older patients, we never inject the patellar tendon itself. There's a risk of rupture there, and so you won't find any orthopedist willing to accept that, and that's the wrong answer, to do an injection in that area for specifically patellar tendonitis. Icing, of course. Anti-inflammatories orally. There's topical anti-inflammatories as it may soak in and get into there, and then activity modification. So those are the sort of cornerstones to making patellar tendonitis go away. The nice thing that I tell to all our young athletes is it's self-limited, meaning it's going to go away, but you got to hit it from all these different angles. And I say, all right, pick 4 to 6 weeks and let's do everything all at once, and let's break this cycle. And it usually does not last for years and years and years. Sometimes it does, but usually it's more of a month thing. It lasts a couple of months, cycle breaks, and then they don't deal with that again. And a lot of them will actually just sort of grow out of it too if it becomes persistent. So that's my overview on patellar tendonitis. If you think you've got it, then come see us and let's see about treating you at Vail Summit Orthopedics. Dr. Joseph.